Ma'am, I'm so sorry, but Dr. Pierce isn't currently accepting new patients with your insurance plan. The receptionist's smile was the small, fixed, surgically polite smile of a woman who had been instructed exactly what to say and exactly how to say it. Sabrina Holland, 38 years old, sitting in the cream-colored waiting room of Pierce Family Dentistry, with the entire left side of her face throbbing from a cracked second molar she had cracked on a piece of caramel at 11:47 p.m. The previous night did not raise her voice. She did not argue. She held the laminated Blue Cross Blue Shield PPO card she had presented 40 seconds earlier in her right hand. She held a printed list of in-network providers from the BCBS NC website, which she had pulled up on her phone in the parking lot before walking in, and on which Pierce Family Dentistry was listed in bold black letters as a current in-network provider. In her left hand, she set both down, slowly, on the corner of the reception desk. She asked, in the careful, professional voice that she had been trained to use in rooms where it was about to become important to remember exactly what had been said, whether she could please speak with Dr. Pierce directly. The receptionist's smile tightened. The receptionist disappeared through the door behind the desk. Sabrina waited. She could see, through the partially open door, a glimpse of Dr. Whitney Pierce standing in the hallway in her white coat, listening to the receptionist explain that the patient is being insistent. She watched Dr. Whitney Pierce shake her head, very slightly, and gesture with one hand toward the parking lot. The receptionist returned. The receptionist told Sabrina, with the same fixed, polite smile, that Dr. Pierce was unavailable and that Sabrina would need to leave the premises. Sabrina nodded once. She picked up her insurance card. She picked up her printed list. She did not pick up the laminated information sheet about new patient registration that had been on the corner of the desk. She walked out of the office. She walked across the cream-colored carpet of the building's lobby and out the glass front doors. She sat in her white Toyota Camry in the parking lot for approximately 15 seconds. She rested her forehead against the steering wheel. She breathed slowly through her teeth because the cracked molar was making it difficult to breathe through her mouth without pain. Then she picked up her phone. She made one call. The call lasted approximately 4 minutes. By 6:18 p.m. that same Tuesday evening, 7 hours and 22 minutes after Dr. Whitney Pierce had instructed her receptionist to refuse service to Sabrina Holland in the waiting room of Pierce Family Dentistry, a 15-page emergency motion had been filed with the North Carolina State Board of Dental Examiners. By 9 a.m. Wednesday, 3 investigators had arrived unannounced at Pierce Family Dentistry with a warrant to inspect the practice's patient records for the previous 5 years. By Friday morning at 11 a.m., exactly 48 hours after Sabrina Holland had limped out of the waiting room with a cracked molar, Dr. Whitney Pierce was sitting at her kitchen table in Cary, North Carolina, reading the emergency order of license suspension that had been hand-delivered to her front door by a state license process server at 10:47 a.m. that same morning. The order had been signed by the executive director of the board. The signature line had been notarized. The effective date was immediate. 3 months earlier, Sabrina Holland had been sitting at her desk on the 17th floor of the North Carolina State Board of Dental Examiners offices on Wade Avenue in Raleigh, opening the morning mail that had been routed to her by the board's intake clerk. 38 years old, born and raised in Durham, bachelor's degree in public health from North Carolina Central University, master's in healthcare administration from UNC Chapel Hill, 12 years as a state regulatory investigator, first at the Department of Health and Human Services, then at the Board of Pharmacy, and for the previous 4 years at the Board of Dental Examiners, where she had been promoted in her second year to senior compliance investigator, and where her caseload included approximately 40 active investigations at any given time, ranging from billing fraud to practitioner impairment to violations of the state's professional conduct rules. She had a reputation, in her office and among the practitioners whose conduct she investigated, for being unfailingly polite, methodically thorough, and almost impossible to bluff. She had closed her last 47 investigations with formal findings. 31 of those findings had resulted in formal sanctions. 8 had resulted in license suspensions. 3 had resulted in permanent license revocations. She kept a small framed photograph on her desk of her 2 children, Marcus, 12, and Naomi. 9 and a coffee mug that had been given to her by her former supervisor when she had been promoted, which read in small letters around the rim, methodical, patient, done. The 4 anonymous complaints had arrived in the board's intake system between February 14 and March 9th of that year. All 4 had been filed through the board's online complaint portal. All 4 had concerned Pierce Family Dentistry in Cary, North Carolina. All 4 had alleged, in slightly different language, that the practice was engaged in a pattern of racially discriminatory patient selection. The first complaint had been filed by a black woman who had been turned away with the explanation that her insurance was not accepted. She had subsequently confirmed, by calling the practice as a white-sounding voice the following day, that her insurance was in fact accepted. The second had been filed by a black man whose wife was a current patient there and who had been told the practice was not accepting new patients. The third had been filed by a Latino family who had been refused emergency service for their 7-year-old son. The fourth had been filed by a black woman who had been a patient for 6 years and who reported that Dr. Pierce had recently and abruptly informed her that the practice was transitioning to a different patient population and that she should seek care elsewhere. The 4 complaints, taken together, established what investigators in Sabrina Holland's line of work referred to as a pattern of differential treatment, a phrase that in state regulatory law was the foundational basis for opening a formal equal protection investigation under the North Carolina Patients' Bill of Rights. Sabrina had opened the file in mid-March. She had not, in the 6 weeks since, conducted any active investigation because the board's standard procedure required a preliminary review period during which the practice was not yet on notice and during which the investigator could quietly gather background information. She had pulled the practice's billing records from the previous 5 years from the major insurance carriers. She had pulled the demographic breakdown of the practice's active patient panel. The data showed that Pierce Family Dentistry, located in a Cary zip code, whose population was 19% Black, 11% Latino, and 8% Asian, had an active patient panel that was 96% white. The practice's new patient acceptance rate among inquiries from non-white callers, as identified by the practice's own digital phone records the board had subpoenaed quietly in late April, was 31%. The new patient acceptance rate among inquiries from white callers in the same period was 87%. The numerical case had been, in the assessment of the board's chief counsel, who had reviewed Sabrina's preliminary findings the previous week, as clean a discrimination pattern as we've seen at this board in 11 years. The board had been preparing over the following 60 days to conduct a formal on-site inspection of Pierce Family Dentistry that would have been scheduled in advance and resolved through what was expected to be a negotiated consent order. Dr. Whitney Pierce had not been on notice. Dr. Whitney Pierce had also not been Sabrina Holland's dentist. Sabrina's own dentist, a black female practitioner named Dr. Aisha Compton, had a small practice in Durham that Sabrina had been driving to since her first child was born. Dr. Compton was, however, out of the country for a 3-week dental missionary trip in Honduras, which she did every spring, and her practice was closed. Sabrina had not had any reason to need emergency dental care during any of Dr. Compton's previous mission trips. She had also, until 11:47 p.m. on the previous Monday night, never cracked a tooth on a piece of caramel her son Marcus had bought at a Halloween-themed candy sale at his middle school 6 months earlier, and that Sabrina had absent-mindedly unwrapped while watching the news. She had not slept Monday night. She had taken 3 ibuprofen at 1 a.m. and another 3 at 4:30 a.m. She had lain in bed with a bag of frozen peas pressed against her cheek. By 6 a.m. Tuesday morning, she had been unable to drink her coffee without sharp pain shooting up the side of her face. She had Googled emergency dentist near me. She had pulled up the BCBS NC website to confirm in-network providers near her home in Cary. Pierce Family Dentistry was the second closest in-network provider on the list, after a practice that did not open until 10 a.m. Pierce Family Dentistry opened at 7:30 a.m. Sabrina had not, at any point that morning, connected the name Pierce Family Dentistry to the open investigation she had been quietly building for 6 weeks. She had been working her active caseload of 40 practices. She did not, in the dim haze of a sleepless night and a throbbing molar, recognize the name of the practice she was about to walk into. She had brushed her teeth carefully on the right side. She had gotten dressed. She had driven 6 minutes from her house to the office park where Pierce Family Dentistry was located. She had walked through the glass front doors at 7:42 a.m., holding her insurance card and her phone, and the printed list of in-network providers she had taken the precaution of bringing with her because she had been a state regulatory investigator long enough to have learned over 12 years that bringing your own documentation to any healthcare interaction was a habit worth maintaining. Dr. Whitney Pierce had been 46 years old, divorced, the mother of 2 college-age children, and the sole owner of Pierce Family Dentistry, which she had founded in 2012 after 8 years as an associate at a larger practice in North Raleigh. She had earned her DDS at the University of North Carolina School of Dentistry. In 2004, she had been a member of the American Dental Association, the North Carolina Dental Society, and the Junior League of Raleigh, where she had served as the chair of the membership committee for 2 years. She drove a 2023 Mercedes GLE. She owned a small beach house at Emerald Isle. She had been, by every conventional metric of her profession, successful. She had also, beginning approximately 3 years earlier in conversations with her practice manager and her 2 senior hygienists, begun to articulate what she described as concerns about the changing demographics of our patient panel and how that's affecting our office culture. The practice's patient panel had, in the 3 years since those conversations began, undergone the demographic transformation that the board's data had captured. The practice had quietly stopped accepting certain Medicaid plans, despite continuing to list those plans on its website as accepted. The practice had instituted what Dr. Pierce had described in an internal memo to her front desk staff in 2023 as discretionary new patient screening protocols that in their actual implementation had been a quiet system for redirecting non-white collars and walk-ins toward other practices. Dr. Pierce had not, in those 3 years, written down or said out loud any of the things she was actually doing in language that would have allowed an outside observer to identify them clearly. She had kept her motives ambiguous, her instructions verbal, and her decisions discretionary. She had believed this would be enough. The morning of the incident, Dr. Pierce had arrived at the practice at 7:24 a.m. She had reviewed the day's schedule. She had been told by her front desk receptionist, a young white woman named Hannah, that a walk-in patient had just arrived, a black woman with a cracked molar, holding a BCBS card and asking to be seen. Dr. Pierce had walked to the small window beside the door that allowed her to see into the waiting room without being seen herself. She had looked at Sabrina Holland for approximately 4 seconds. She had returned to Hannah. She had told Hannah to inform the patient that the practice was not currently accepting new patients with her insurance plan. Hannah had hesitated. She had said very quietly, "Dr. Pierce, we are accepting BCBS patients on the schedule today." Dr. Pierce had given Hannah the small, fixed look that Hannah had come to recognize over her 11 months at the practice as the look that meant, "Do what I told you and don't ask questions." Hannah had nodded. She had gone back to the front desk. She had delivered the script. Sabrina Holland had sat in her white Toyota Camry in the parking lot. She had rested her forehead against the steering wheel. She had breathed slowly through her teeth. She had thought, in the slow clarity of severe pain and 12 years of regulatory experience, about exactly what had just happened. She had connected the name. She had remembered the file. She had remembered the 31% versus 87% acceptance rate. She had remembered, with the precise mental clarity that severe pain sometimes produces, that she had become, in the previous 15 minutes, the 5th person to be turned away from Pierce Family Dentistry on the basis of patterns the board had been documenting for 6 weeks, and that she was, by professional certification and statutory authority, the senior compliance investigator assigned to the case. She picked up her phone. She did not call her supervisor. Her supervisor would not have appreciated being called from a parking lot. She called the board's deputy executive director, a woman named Diane Easterly, who had been Sabrina's mentor for 8 years, and who had told her, in a conversation at a regulatory conference in Asheville 2 years earlier, that there were times in their line of work when the correct response to a situation was to act first and explain later. Because the act of acting was itself the protection of the public the board had been chartered to provide. The call connected on the second ring. "Diane, it's Sabrina. I'm sitting in a parking lot in Cary. I was just refused service at Pierce Family Dentistry. The walk-in receptionist told me they aren't accepting new patients with my insurance. I confirmed before walking in that they are in network with BCBS NCPPO. I have 2 BCBS patients on their schedule today that the receptionist confirmed to me before I asked to see the doctor. I asked to speak with Dr. Pierce directly. She refused. She had me escorted off the premises. Diane, it's the Pierce case. I'm the case. I just became the 5th complainant. I need you to authorize an emergency on-site inspection within 24 hours. I have a cracked molar, and I'm going to my own dentist's covering practitioner in an hour. I'll be in the office this afternoon. I need you to greenlight this before I get there. Diane Easterly took approximately 7 seconds to respond. Sabrina, did anyone in that office at any point see your state ID? Did they know who you were? They saw a black woman with a cracked molar and a Blue Cross card. Okay, get to your dentist. Document the tooth. Save the imaging. I'll have legal start drafting the emergency motion now. We'll have inspectors on site tomorrow morning by 9. Take care of yourself, honey. We've got this one. You're going to be the worst kind of complainant for her. You know that, right? Yes. Good. Go to the dentist. Sabrina hung up. She started the engine of her Toyota Camry. She drove 11 miles to a practice in Apex, run by a colleague of Dr. Compton's named Dr. Jaime Castillo, who had agreed in an arrangement Dr. Compton had set up before leaving for Honduras to cover emergencies for her patients during the 3 weeks she was away. Dr. Castillo's office had Sabrina in a chair within 20 minutes. The cracked molar was a vertical fracture that had extended to the pulp chamber. Sabrina was given a temporary crown, prescribed antibiotics and a stronger painkiller, and scheduled for root canal treatment the following Monday. Dr. Castillo had been, although Sabrina had not realized this until she had introduced herself, a former member of the North Carolina State Board of Dental Examiners Patient Advocacy Subcommittee. Dr. Castillo took the time, before Sabrina left, to write a brief but detailed contemporaneous letter regarding the patient's presentation, the timing, the patient's reported account of what had happened at Pierce Family Dentistry, and Dr. Castillo's own professional opinion that the symptoms Sabrina had presented with constituted in clear clinical terms a dental emergency that should have been seen immediately by any qualified general dentistry practice within reasonable geographic proximity. Dr. Castillo had handed Sabrina the letter in a sealed envelope. Dr. Castillo had said, in her quiet, professional voice, "Use this if you need to." Sabrina had been at her desk at the board offices on Wade Avenue by 12:14 p.m. By 1 p.m., the emergency motion was being drafted by the board's chief counsel, working with Sabrina and with Diane Easterly. By 3 p.m., it had been reviewed by the board's executive director, James Whitcomb, a man who had been a state regulator for 29 years and who had read through the existing case file on Pierce Family Dentistry in approximately 20 minutes before turning to Sabrina and saying, in the same quiet professional tone Dr. Castillo had used, "Sabrina, are you absolutely certain you want to be the named complainant on this one?" "Yes, sir." "You understand it will compromise your ability to be the lead investigator?" "I'm not going to be the lead investigator, sir. I'm going to be the complainant." Diane has reassigned the case to Kevin Park as of this afternoon. I've already given him the full file. Smart? Sabrina, I'm sorry. Thank you, sir. By 6:18 p.m., the emergency motion had been filed. By 9 a.m. Wednesday, 3 investigators, not including Sabrina, who was at home with an ice pack on her face and a script for Tylenol with codeine, had arrived at Pierce Family Dentistry with a warrant signed by a Wake County administrative law judge late the previous evening. They had inspected the practice's patient records for the previous 5 years. They had interviewed Hannah, the front desk receptionist, who had cried for 90 minutes and then told the investigators everything. They had interviewed the 2 senior hygienists, both of whom had hired their own attorneys before the day was over. They had interviewed the practice manager, who had told the investigators in a recorded statement that the discretionary new patient screening protocols Dr. Pierce had instituted in 2023 had been verbal and that they had specifically been understood by the front desk staff to apply to non-white callers and walk-ins. They had requested and received under warrant the practice's phone records, internal email, internal memos, and a 2023 internal document Dr. Pierce had drafted and saved on the practice's shared server titled PFD Patient Panel Quality Standards, a document the investigators recognized within approximately 15 minutes of reading it as the written distillation of the verbal policies the practice manager had just described in her statement. By 4 p.m. Wednesday afternoon, the board's emergency review panel had convened by phone. By 7 p.m., the panel had voted unanimously to issue an emergency order of license suspension under the North Carolina Patients' Bill of Rights, pending a full formal hearing within 60 days. By 8 a.m. Thursday, the order had been finalized, notarized, and entered into the state's professional licensing system. By 10:47 a.m. Friday morning, exactly 48 hours after Sabrina Holland had limped out of the waiting room with a cracked second molar, Dr. Whitney Pierce was sitting at her kitchen table in Cary, North Carolina, reading the emergency order that had just been hand-delivered to her front door. The order ran 15 pages. It cited 18 findings of fact. It cited the 4 anonymous complaints that had been on file since February. It cited the demographic data on the practice's patient panel. It cited the 31% versus 87% new patient acceptance rate split. It cited the practice manager's recorded statement. It cited Hannah's recorded statement. It cited the internal PFD patient panel quality standards document. It cited Sabrina Holland's complainant statement, which had been filed under her professional name and title. It cited Dr. Castillo's contemporaneous medical letter. It cited Section 941A1 and Section 941A2, 4 of the North Carolina General Statutes governing professional misconduct and patient discrimination by licensed dental practitioners. The order was effective immediately. It required Dr. Pierce to cease all clinical activity at the practice, to surrender her practice's controlled substance registration to the state DAA office within 72 hours, and to refrain from representing herself as a licensed dentist in any communication with any current or prospective patient. The order set a formal hearing date for 53 days hence at the board's offices in Raleigh. Dr. Whitney Pierce did not, at first, finish reading the order. She set it down on the kitchen table. She walked to the kitchen sink. She held the edge of the counter with both hands. She breathed slowly for approximately 90 seconds. She picked up her phone. She called her ex-husband, with whom she had not spoken in 14 months, because she could not, in that moment, think of anyone else to call. The ex-husband, an orthopedic surgeon who had built his own practice and who had been quietly relieved 2 years earlier, when Whitney's behavior in the final year of their marriage had finally given him a clean reason to leave, did not answer. The call went to voicemail. Whitney did not leave a message. She returned to the kitchen table. She finished reading the order. The formal hearing, 53 days later, was held in the board's main hearing room on Wade Avenue in Raleigh. Dr. Whitney Pierce attended with her attorney, a senior partner from a Charlotte-based healthcare regulatory firm whom she was paying $1,250 per hour. The board's case-in-chief was presented by Kevin Park, the investigator to whom Sabrina's case had been reassigned 6 weeks earlier. The case was, in the assessment of Park's colleagues afterwards, the most thoroughly documented equal protection case in the board's institutional history. It included testimony from Hannah, who had been granted limited immunity in exchange for her cooperation and who would later be hired after her testimony by a Black-owned pediatric dental practice in Durham. It included testimony from the practice manager. It included expert testimony on the statistical patterns of new patient acceptance and patient panel composition. It included video deposition testimony from Sabrina Holland, who appeared remotely without speaking on behalf of the board, only on behalf of herself as a complainant. The board's hearing panel deliberated for approximately 3 hours. The vote was 6-1 in favor of permanent revocation of Dr. Whitney Pierce's license to practice dentistry in the state of North Carolina. The final order of revocation was entered into the state licensing system the following Monday. Dr. Whitney Pierce's appeal, filed 30 days later through her Charlotte attorney, was denied at the administrative level 6 months after that and denied at the Wake County Superior Court level the following year. She had not, by the time her appeals were exhausted, practiced dentistry for 16 months. The beach house at Emerald Isle had been sold. The Mercedes had been traded for a 2017 Honda CR-V. The Junior League had quietly removed her name from its membership rolls without sending her a formal notice. Sabrina Holland did not, in the months following the hearing, give any public interviews about the case. She continued to work at the board. She closed her next 23 investigations. She drove her son Marcus to soccer practice on Tuesday afternoons, and her daughter Naomi to violin lessons on Thursday afternoons. She had her root canal completed by Dr. Castillo's covering colleague the Monday after the incident. She received a permanent crown 4 weeks later. She kept the receipt from that visit in the same folder as the original receipt from her Tuesday emergency visit in a fireproof box in the bottom of her bedroom closet, alongside Dr. Castillo's sealed letter, which she had never needed to open. On a Saturday afternoon in October, 6 months after the final order of revocation had been entered, Sabrina Holland was at a small park near her house in Cary, watching her daughter Naomi play with a friend from school. The friend's mother, a black woman named Daria Whitehead, whom Sabrina did not know well, sat down beside her on the wooden bench beneath the oak tree by the playground. They watched their daughters for a long moment in companionable silence. Then Daria turned to her and said in a tentative voice, "Are you Sabrina Holland?" "I am. My sister's dentist was Dr. Whitney Pierce. My sister got the letter about a year ago, I guess, that the practice was transitioning to a different patient population, and she should go elsewhere. She'd been a patient there for 6 years. She was one of the people who filed the original complaints. She told me, after the news broke, that someone she'd never met had been quietly working on her case for months. She told me your name." Daria paused. Her voice grew quieter. I just wanted to say thank you. From my sister. From me. From whoever else needed somebody to do what you did. Thank you." Sabrina nodded. She did not, at first, know what to say. She looked at Naomi, who was at that moment laughing at something the other little girl had said by the swings. She said finally, "Tell your sister I'm sorry it took 6 weeks, and tell her I'm glad she filed her complaint. People like your sister are the reason I have a job. I'm just the person who reads the mail and follows up. The work is hers." She nodded. The two of them sat on the bench beneath the oak tree and watched their daughters play. The October light came down through the leaves in patches of warm gold across the playground. Somewhere across the park, a child laughed. The day continued around them, ordinary and quiet, in the unremarkable way that most afternoons continue when the necessary work of the morning has been done.